Hello, dear colleagues. I will talk about vitreoretinal surgery under fluoroscopic visualization with Ngenuity digital visualization system. Here is how basically the intraoperative angiofluoroscopy is done. It's made with a digital barrier filter in order to visualize the filling with fluorescein of the vessels and capillaries of the fundus. Here you might see that there is a semi-leakage and really good arterial filling. Here you might see a non-exudative retinal detachment confirmed by FFA, and here you might see proliferative diabetic retinal disease, and you might also observe the capillary dropout here. So this is useful, and it might affect our decision for how much laser we might apply, or do we do a complete pararetinal laser or not. Also, we might find if there are still leaking vessels, which we might treat with endodiathermy. So the good thing is that with the different phases of the fluorescein angio, we might appreciate additional structures. Also, with the function of the picture-in-picture, we might compare the early phases with the later phases of fluorescein angio. Also, if we have a video shot on the fluorescein angiography, we might overlay with the late images and to see how is the structures and the functioning of all the vessels of the this particular fundus. So I think it's important to have it during intraoperative maneuvers. Here you can see vitrectomy under fluoroscopic view, and it might change the way we understand and actually perform vitrectomy, especially in the periphery, because up to now I'm pretty sure that all of us leave some amount of vitreous because simply we don't see it. When we have a fluorescent dye which is embedded or it is in the vitreous because it is highly soluble as the fluorescein, we can see where is the vitreous and we can clean it. And with the digital visualization and the filters that we can apply on the image, we can certainly see the underlying structures and underlying fluids. If you carefully look to the fundus, you will see a subretinal fluid which is stained with fluorescein, because this is a retinal detachment. Also, what is important here is that I can judge my distance from the retina, which is actually attached, and safely remove the it is detached retina, sorry, and I can safely remove the vitreous without pulling the retina, and you can see how close I am to the retina. Why? Because I see where is the vitreous. I don't need to anticipate or guess if I remove vitreous or I'm too close to the retina. So with the fluoroscopic view, it actually enhances my my ability to perform more precise the surgical maneuvers. This is the beauty of the digital visualization, and it's something that we don't fully comprehend up to now. We aim to achieve digital view, which should be similar to the high-end analog one. And that way we lose actually additional information. We need to think outside the box, and we need to learn new ways to visualize the structures in the eye. As you see here, with the applied filter and method of visualization, I see much more vitreous and ocular structures which are at the moment of interest for me compared to my regular analog view. So we need to disrupt a little bit our thinking and to untether ourselves from the classical analog view with the classical color representation. So we need to flex a little bit more our ability to perceive the information and to learn a new ways of seeing the structures inside the eye. Here, this is intraoperative fluoroscopy in a case with branch retinal artery occlusion. And you might appreciate, of course, the area of non-perfusion and the area there where there are still capillaries and perfusion. Here it is really important to see one phenomena. Is this a newly emerged blood, or it was a blood collection, or there is a vessel underneath? Of course, because we are in a fluoroscopic view, we are 100% sure that this was a blood collection. Otherwise, there should be a fluorescein leaking. So this is a differential diagnostic approach. Here I see a leaking point, which I will treat with endodiathermy, and that way I will be able to preserve the eye from recurrent hemophthalmos, because this surgery is performed exactly because of hemophthalmos. Here is the area where the blood was collected, and there was another spot where there was leaking, another vessel with a leaking point, which I might treat under fluoroscopic view. So this is the big difference. And here I see two sort of embolos, but I'm not sure. So my intraoperative angioscopy show me that there is perfusion. So these are might be arteriosclerotic plaques, but not plugs. Thank you for your attention.